Hello, I'm John Remmers. I'm Chief Medical Officer of Zephyr Sleep Technologies. Zephyr makes and distributes MATRx. It's a new in-lab titration device that allows selection of the right patients for oral appliance therapy. What do we do now when we encounter patients with obstructive sleep apnea? Well, we start all of them on nasal CPAP. There are problems to this approach, however. They relate to the adherence to therapy and of compliance. The alternative on the horizon is oral appliance therapy. It accounts, though, for a very small percentage of the total therapy, 5%. This is despite the fact that patients prefer oral appliance and it has better compliance than nasal CPAP. So why are oral appliances so underutilized? Simple. The treatment is only effective in 50%. So 50% of patients are efficaciously treated with oral appliances, and our problem is to decide which ones. Another problem is that the dentist doesn't know where to set the mandible. This is like a physician not knowing what dose to use in giving a drug. So this adds to the uncertainty around this therapy. Let's sum up by saying that both the sleep physician and the dentist are operating in the dark. This is not a good place to be. The solution is MATRx. This is the business end of MATRx, consisting of the blue trays on the left connected to a mandibular positioner on the right. The trays are temporary trays. They get filled with an impression material and fitted to the upper and lower teeth. Then on the night of the polysomnographic study, they are connected to the mandibular positioner and are protruded, the lower jaw is protruded sequentially in response to respiratory events. So we have a polysomnographic mandibular titration device that determines first the patient's response to oral appliance therapy and second the target protrusive position. Here it is in the mouth, and you can see it's unobtrusive and comfortable for the patient. I'm going to present a case to you. This is a case of a patient who is obese and has severe sleep apnea. This is a hypnogram that was derived from the MATRx titration study. On the bottom you can see the mandibular position starting at the horizontal dashed red line, which is rest, and going up to the horizontal blue line, maximum. At interval 1, we have the patient in non-REM sleep, supine, and no respiratory events are being recorded. However, in interval 2, we have scads of respiratory events with moderate protrusion. The patient is still on the side, but in REM sleep. So we have not eliminated sleep apnea, so we move on to intervals 3 and intervals 4. At this point, we have the mandible protruded to a moderate level of 14.5, and we encounter 2 episodes of REM sleep supine. And it's wonderful to see that in both episodes, we have 1 respiratory event only. In other words, in the worst case scenario, REM sleep supine, the mandibular protrusion has eliminated the respiratory, the sleep apnea entirely, and we can label this patient a predicted success at a target protrusive position of 14.5. The therapy was carried out, and with the oral appliance in place, we had an AHI of 4, down strikingly from the control value of 41. We have carried out 3 trials with MATRx, and the most recent involved 67 patients. It appears in the October 2013 issue of the journal Sleep. Should you have any further questions about details of our study, you can find the details there. The trial was to evaluate the predictive accuracy of MATRx. All patients received a MATRx polysomnographic titration, and then all patients received an oral appliance. It was a Somnodent appliance that was positioned at the target determined from the study within 3 weeks. The sleep physician, the dentist, and the patients were blinded. For inclusion criterion, we were quite broad. You just had to have an AHI greater than 10 and a BMI less than 40. Mean saturation had to be greater than 90. Here's the outcome that we observed plotted with regard to AHI and BMI. The green dots are the patients who were successfully treated with the Somnodent oral appliance, the overall success rate was 58%. The red squares are those who were therapeutic failures. You can see on this plot with these two variables, there's no segregation of the green and the red symbols. This means that neither seem to predict. In fact, neither baseline AHI nor BMI predicted the therapeutic outcome. Adjusted neck circumference and age were weakly predictive, but not sufficient for clinical purposes. Here's what really predicted. It was the results of the MATRx study. I've divided our 67 patients into two groups, those predicted to have success and those predicted to have failure with the oral appliance. The prediction was made only from the MATRx study. On the left, with predicted success, you see the AHI at baseline ranged from 11 up to 58, and then with therapy, that is to say, with the Somnodent appliance in the mouth and adjusted to target position, all the values were less than 10. So everything funnels down neatly, orderly to less than 10. Whereas with predicted failures, we have a similar distribution at baseline, but with therapy, some get less than 10, some decrease but not enough, and others actually worsen. Their AHI actually increases. So a very distinct difference between the two prediction groups based only on MATRx prediction. Here's a quantitation of that. I'm going to show you therapeutic success and therapeutic failure along the side, and across the top, predicted success and predicted failures. You'd like to have all the patients lie in the two green boxes. That is to say, predicted successes to actually be therapeutic successes with the oral appliance in the mouth, and similarly, predicted failures to be therapeutic failures. Well, how did we do? Of the 32 patients in the predicted success category, 30 were actually therapeutic successes. So 30 out of 32 times our prediction was correct. That's high positive predictive value. With regard to predicting failures, of 29, 24 were therapeutic failures actually, and 5 who were predicted failures were therapeutic successes. So overall, we have really a strikingly strong predictive accuracy with positive predictive values of 94 and negative predictive values of 83%. This is very adequate for clinical purposes. For target protrusive accuracy, we had similar high values of 31 patients who were predicted to show success at target. 27 were successful at that target, and 4 needed a bit more protrusion, but overall we can say that the positive predictive accuracy of our target from the MATRx study was 87%. Again, quite acceptable for clinical purposes. Patient's acceptance is really key. Overall, it was much better than for a CPAP titration. The patients judged the trays to be comfortable, and they had no difficulty falling asleep. Importantly, the trays did not dislodge during the study. This means that unlike a CPAP titration study, the technician did not have to re-enter the patient room throughout the night. Well, how did MATRx change things? First, MATRx provides a gateway to integrated patient-centered care. That's key in moving sleep medicine into the modern realm. Secondly, it replaces the one-size-fits-all approach to management of obstructive sleep apnea. Finally, treatment is optimized in the initial stages, thereby providing better and more cost-effective outcomes. For the physician, we have now informed management decisions, and this means that the physician has greater confidence, particularly in oral appliance therapy. For the dentist, we have an improvement in efficiency since the number of visits required per device go down as we know the target. And finally, and in addition, for the dentist, there is an increase in the percentage of therapeutic successes so that overall outcomes are much better. Finally, and most importantly for the patient, we now provide a true alternative to CPAP, and this alternative will increase the compliance as well as the quality of life, since the sleep experience is much better with an oral appliance than with nasal CPAP. I hope you've enjoyed this, and if you would like to learn more about MATRx, contact us at Zephyr Sleep Technologies at the number shown. In addition, note that Zephyr has recently launched our new social media sites, so we invite you to like, follow, and connect with us, as well as watch our expanding library of YouTube videos. Thank you very much.